The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Good evening everyone. Welcome to a brand new episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Anupama Menon. In this talk show Health World, we have expert doctors from various fields providing valuable information to all of you to assist you all on your journey towards good health. Eyes are the most precious and vital organs of our body. As the saying goes, the eye is the jewel of the body, the windows to our soul. If you want to live life to the fullest and enjoy the beauty of the world in its full glory, you need perfect and healthy eyesight. Cataract is a very common ailment that affects mostly elderly people, that impairs their vision to a great extent and that actually prevents them from leading a normal life. I'm sure many of you would like to know more about cataract and its various implications because we all have elderly people at home, our parents, our grandparents. So to know more about cataract, we are happy to have with us today Dr. Rajeev Krishnappa, specialist ophthalmologist from Al Hilal Hospital, Muharraq. He comes with an experience of over 12 years in the field of ophthalmology. So let's go over to him and know more about cataract. Doctor, welcome to the show and thank you for joining us.
Thank you.
How are you doing today?
I'm good, thank you.
So doctor, cataract is a very common term. I'm sure most of our viewers have heard about it.
Right.
But what exactly is it in medical terms? If you could just describe it for the benefit of the viewers.
Yes, to put it simply, any opacity in the lens is a cataract. And like you said, it's most commonly seen in the elderly
people.
But it can actually happen in anybody, any age group.
Okay, so what exactly causes cataract?
What happens is, as we age, the lens fibers are more concentrated in the center. More lens fibers are laid down from the periphery towards the center. So the lens fibers start losing their transparency. When they become opaque enough that the vision is disturbed, we clinically see that as cataract and term it cataract.
Cataract. Okay, so when we talk about cataract, the first thing that comes to our mind is that it affects only elderly people.
Right.
Maybe that's a wrong impression that we have. But you just mentioned that even youngsters can
Yes.
be affected. So is there any particular age group that is more prone to getting this?
More prone to getting cataract, as you mentioned rightly, elderly people are the ones who are more prone to get cataract. It's basically an age related process. As
Okay.
more and more lens fibers are laid down, the fibers in the center are not as transparent as they used to be. So this is a normal age related process leading to cataract. You would be surprised to know that even newborns may sometimes have cataract.
Okay.
It's called as congenital cataract. Again, there are various causes. Causes in the sense, even when the child is still in the womb, there can be certain infections which can cause cataract. As they grow older, if say the cataract happens somewhere after they are born, we generally term that as developmental cataract. Then there are various other conditions that affect the other parts of the body, which can affect the lens as well in the eye. So there can be secondary cataracts. We term this as secondary cataract. Secondary in the sense it's secondary to some other disease in the body. For an example, skin condition, atopic dermatitis can cause cataract, a special type of cataract. Some metabolic disorders can cause cataract. Any injury to the eye can cause cataract.
Okay, so basically it's an age related disorder, but according to you it can happen to
Yes, it can
people
happen
of
to
any
anybody,
age. But
any
it would
age.
be rare, I guess, in your observation. Is it very common to see people, youngsters also having cataract, or?
It is not very common,
Okay.
not very uncommon also.
Okay, so what are the symptoms to look out for? How does
Right.
one know that, you know, there's an onset of cataract? Is there vision
Yes.
loss, or what are the basic symptoms?
So one of the first symptoms when it's really early, most elderly patients come to us with glare, especially when they are driving at night. They find that there's too much dispersion of light. Many patients describe it as various symptoms.
Okay.
Some people directly tell that they are just not able to see so clearly as they were seeing before. That's the first symptom. If it progresses to such an extent that they are not able to see anything at all, that's usually in this part of the world they present to us much earlier. Sometimes in India we see that they come quite late. That's when they are not able to see anything at all. They can just about perceive light. That's almost end stage cataract. The cataract is mature by then when they are able to see only light.
Okay, so the symptom that you mentioned just now, could this be indicative of any other eye ailment, or is this
Yes.
specific to cataract only?
Right, that's a good question. The thing is, most eye conditions which lead to a loss of vision or even decrease in vision will present like this. They will have decreased
same
vision.
symptom, yes.
So these symptoms are not specific to cataract. So any patient with any decrease in vision should come to a doctor for further assessment. There is no way for a patient to diagnose that he has cataract just by his symptoms.
Okay.
We need to look at the eye.
It's better to visit the doctor whenever
Yes.
you feel your vision is
Any
being
decrease in vision,
impacted.
any abnormality in vision also.
Okay.
Some patients describe seeing colored halos around the lights. That's actually quite, it makes us suspicious of another condition called glaucoma, but it can be seen sometimes in early stages of cataract.
Cataract as well. So I guess doctors are the best judge to find out. And doctor, what about diabetic patients? Because we have heard that diabetic patients are prone to having eye-related ailments. So does that play a role in cataract as well?
Yes, diabetes itself can lead to an accelerated rate of progression of cataract. and diabetes itself can cause a different type of cataract. Next thing, most patients present with decreased vision when they sugar levels are not under control. We think of retinal disorders. There is something called as diabetic retinopathy.
Okay.
Any patient who has had diabetes for more than 10 years, we will suspect diabetic retinopathy. This is like I am telling when we have not yet seen the patient. But if they are elderly, non-diabetic from many years, we also think of cataract. Ultimately, when we look at the eye itself, we will be able to tell whether he has cataract or diabetic retinopathy or both.
So if it is cataract in a diabetic patient, how is
Yes.
it treated?
The treatment for cataract itself is the same, irrespective of
Whether
the
they're diabetic or
cause.
not.
Yes,
Okay.
irrespective of the cause, age. They are not going to be corrected by spectacles,
Okay.
at least when it has advanced enough. So in diabetes also the treatment is the same. We have to actually do a surgery.
Surgery. Okay. And surgery, I mean, could you please describe to us in details how exactly what happens during a surgery, because it's quite a scary thing for many of
Yes.
us, undergoing
Right.
eye surgery. So
Yeah, so cataract is one of the most commonly performed surgeries in the world.
yes.
It's among the safest also. What we actually do is we remove a part of the lens, basically the cataract is part of the lens, and replace that lens with another artificial lens. We call it an intraocular lens,
Okay.
since it's inside the eye. We place an artificial lens instead of the natural lens that was present there.
Okay.
In the earlier days, they used to remove the entire lens. Now we leave behind part of the lens. It's called posterior capsule, over which we place the artificial lens. This is the surgery in brief, very brief.
Okay, so is there a procedure whereby you can still, retain that cataract as lens and then insert a new lens? Is that possible?
That will not serve the purpose,
Okay.
because if the lens itself is cataractous, putting a lens in front or behind that lens will not
Will not
allow the
help
rays of light to pass through the cataractous lens.
Okay.
There are certain other conditions where we put a lens in front of a normal lens. Okay, that's like in high refractive errors. Some patients come with say -8, -10 refractive errors,
Okay.
where we can put an artificial lens in front of the normal lens, which is already there in the eye. It is not done for cataract.
Cataract, okay. And in earlier times, I still remember for my grandparents when they underwent cataract, it was like a big surgery, it was considered a really big. But nowadays, with the advent of laser technology and all that, it's become much more simple. So, is it really painful now, and how major an operation is it?
It is a very important surgery, since we are doing almost everything inside the eye. So it is not a simple procedure, but like you said, because of the assistance that we get from technology, it has made our lives easier. We can do many of the procedures, like you said, using laser. But the ultimate removal of the lens, before we used to do it manually, remove the entire lens like this. Now we use a phaco probe. It's not the laser which actually emulsifies. Now we can actually do that as well, but ultimately we use phaco energy, basically ultrasonic energy, to emulsify the nucleus and then aspirate the cataractous part.
Okay, could this be painful, or will there be just
Right.
a minor discomfort?
Yeah, so right now we can do cataract surgeries by just putting topical anesthetic drops.
Okay, so that will numb the area
Yes,
completely.
it's basically going to abolish any sensation, at least on the ocular surface, and abolish most of the pain. So the patients will not really feel any pain. If the patient is not going to be cooperative, if they feel they can't keep looking at one direction, we give an injection around the eye.
Okay.
That's the amount of pain that they'll have. It will not be painful after the injection, and if you are doing it under just drops, I mean, even that injection is not there, so it's not a painful procedure.
So that's reassuring to know, and quite comforting for all our viewers out there also to know that it's not a very painful procedure. And what about the aftercare? Because earlier times, again, I still remember those dark glasses that
Yes.
one had to wear for a long period of time. But now I'm sure things have changed. So what are the
If the patient opts, we still give dark glasses, but now we mostly give transparent glasses.
Okay.
The purpose of the glass itself is that the sides of the eyes are also covered. We basically aim to prevent infections. We don't want any dust particles entering the eye and causing infections. That's one of the most dreaded complications following cataract surgery. It's very difficult if there is an infection inside the eye,
Okay.
which can happen in the initial few days if the patient is not careful. We of course give medicines to prevent all this, but from the patient side also they have to be as careful as possible to prevent infections. That's why we give those glasses and all that. Other than that, they need not take bed rest actually, and with the procedures that we do now, initially we used to advise them not to lift heavy weights and all that. Nowadays it's no longer necessary. They can get back to normal lifestyle within a week, but they have to be careful about preventing infection for at least a month.
Okay. And what about wetting having a head bath,
Yes,
water going
we
into
still
your eyes?
recommend patients to do that after 1 month if we have done a conventional ECC or a small incision cataract surgery. Nowadays we mostly do phacoemulsification and even smaller incisions now. After a week, if we trust the patients enough that they are not going to get their eyes infected, we advise them that they can get back to normal life after a week to 10 days.
Okay.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
And what about the complications that could arise? You just spoke about one about dust particles getting into your eyes. Could there be any other complications that could arise from this surgery?
Dust particles getting into the eye itself will not cause an intraocular infection, thankfully. Most of the complications that we dread, the cause at least, happens during the surgery itself. So we aim to minimize that. We try to prevent infections. Infections, is, like I said, is one of the most dreaded complications. Any surgery, there is a chance of infection. We use as sterile instruments as possible. Whatever irrigating fluids we use will all be sterile. So that's the precautions that we take from our side. In spite of all that, there is a remote chance, especially if the patient is an uncontrolled diabetic, that there can be infections. Other than that, again, in uncontrolled diabetic patients, there is something called as macular edema, which is basically a swelling in the retina. When we do surgery, it's kind of a trauma to the eye. There are lots of inflammatory mediators that are increased inside the eye, and if there is uncontrolled sugar level as well, so there will be some amount of inflammation in the retina. Retina is the innermost nerve layer of the eye. So there can be some swelling there, especially in uncontrolled diabetic patients, but it can happen in other patients as well. These are the two important complications, infection and the swelling in the retina.
So diabetic patients need to be a bit more careful. I guess they should keep their sugar level under control. It's very important.
Before surgery itself, we make sure that
the
sugars are under
normal.
control.
And is surgery the only option for cataract? Can you suggest some kind of an eye drop, or will glasses help to improve the vision? without going in for a surgery? Can it be arrested?
There is no way to stop progression of a cataract.
It cannot be done. Okay.
If it's detected very early, say the patient just has some blurring of vision, he was not using glasses before, now he finds that he is not able to see so well. If it is very early, his vision might in fact improve with glasses. That's still a temporary measure. Ultimately, the cataract is going to progress. How fast it is going to progress, that we usually cannot predict. But once it progresses, he will eventually require surgery. There are no drops as of now that can prevent progression of a cataract or even reverse. There were studies conducted, but nothing concrete has come out of it, at least for the human eyes. We do not have any medications to prevent or regress the cataractous changes in the lens.
So once a surgery is done and cataract is corrected, are there chances for this to recur again?
Yes. So when I described the procedure, I told you that nowadays we leave behind a posterior capsule,
Yes.
which is the posterior most part of the normal lens. If there are some cells which are left behind in the periphery, those cells can proliferate again and cause new lens fibers to be laid down again. This again, if it gets opacified, it will prevent the light rays from entering the eye. We call this as after cataract. So there is an artificial lens already, behind that is a posterior capsule. So if this posterior capsule starts getting opacified, we call that as after cataract. So that's the way, technically that's again cataract forming, but most of the lens is out, it's only the posterior capsule which is opaque.
But it can be again operated upon.
Yeah, so there's no need to operate the after cataract. We basically use a laser to create an opening in the posterior capsule. So there's a hole in the center through which the light rays can pass normally again. The periphery might still be opaque, that will not really matter because the normal pupil size of humans is not dilated all the time. So in the pupillary area, if there is an opening created by the laser, that is enough for the patient to see well again. There's no need to operate again.
No need for an operation.
Yeah.
That's good. So doctor, before we wrap up, can you just explain to us in a nutshell whatever points we discussed here today, you know, the precautions to be taken and when to visit a doctor?
Sure.
When, if you feel your vision is getting impacted or compromised.
Right. So to just sum it up, any patient with any decrease in vision should visit a doctor. Don't try to diagnose yourself. There are various conditions which can cause decrease in vision. Some conditions are more sinister, more dangerous than cataract. If it is actually cataract in an elderly patient, doctor is kind of happy
Confident,
that
then
it
it
is
can
a
be
treatable
handled. Yes,
condition.
yes.
There are various other conditions which are more difficult to handle. And in children especially if it's a newborn, the attending pediatrician will actually look at the baby's eye and see if there is any cataract. But if the parents notice some whitish discoloration, especially in the pupillary area in a child's eye, please come to a doctor as soon as possible. Any age group, any changes in your vision, not just decrease in vision, any alteration in your vision, come to a doctor. Next thing, once we diagnose that it is a cataract, what do we do? Many people ask me whether, like we already discussed, whether it can be corrected by glasses, by using some medicines. If it is significant enough, the patient will eventually have to undergo surgery. The more we wait, when it has come to an operable stage, the more difficult it becomes for the surgeon who is operating. The harder it gets, the more difficult it becomes for us to remove it carefully without complications. Next thing, any patients with say diabetes or hypertension, some people ask me whether they can get operated or not. Anybody can get operated, we just need the sugar level, say in a diabetic patient, to be under control for reasons which I mentioned earlier. After the sugar levels are under control, we can operate. It's the procedure is the same. The patient being a diabetic is not going to affect our surgery as such. It's the after effects. If the patient was not well controlled with the sugar levels, like I said, it can lead to macular edema and all that. Chances of infection will be higher. These are the things that we worry about. Our procedure will still be the same, irrespective of the patient's systemic conditions. Next, after cataract surgery itself, the patient needs to be quite careful about preventing infections. They should not be touching their eyes with hands, except to put drops and ointment that we would advise. Even before instilling those drops, they need to wash their hands with soap and water. All these small precautions need to be taken. After surgery, if they are not able to see so well, if they have redness or pain, come back to the doctor as soon as possible. It might not be anything, but if you notice that something is not normal, please come back. With these little precautions, and like I said, cataract is one of the most commonly performed surgeries in the world, and it is one of the safest surgeries. The patient should not fear cataract or the cataract surgery itself. In fact, if it is cataract in an elderly patient, it is good that it is not something else.
So thank you so much, Doctor. Really appreciate you taking the time out to be here with us today and throwing light on this topic of cataract. Thank you so much once again.
Thank you. It was my pleasure.
So friends, I hope all of you found this episode very informative. For more informative episodes like this, don't forget to tune in to BMC Global Live Al Hilal Health World every Tuesday at 8 p.m. Your eyes are very precious. Do take care of them. Keep smiling, stay healthy and happy always. This is Anupama signing off. Till we meet again next time. Good night. Stay safe.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.